Good afternoon. Thank you so much for joining us here today with Family Network on Disabilities. My name is Latasha Burr. I'll be your facilitator today. I'm the Multicultural Outreach Coordinator for Family Network on Disabilities, and you are joining us here today for one of our vast, vast array of free workshops right here for families. So if you would like for us to keep you in our database and get back with you at a later time, we invite you to use the comment section that you see right here on your screen and let us know where you're from in the state of Florida. And if you're not from the state of Florida, please take the information that we speak on today and adapt it and apply to the state that you are watching us from. We are a PTI, which stands for Parent Training and Information Center right here in the state of Florida, and we help families who have children with complex medical needs and help them to get the resources and information that they would need. Today, we are going to talk about Medicaid and all of those services and resources that we have for families. Today's webinar will highlight navigating the process of Medicaid and highlighting the fact that it doesn't have to be difficult. It doesn't have to be difficult. So today's info session is going to be geared toward fathers and how you can be involved in understanding the application and eligibility for special cases and populations about Medicaid, and also if there are denials, how to navigate that process as well. So, and speaking with dads, we want you to know it's okay to talk about your feelings. It's okay to ask for help. It's even okay to break down if you would need to. Men, they need to know that it's okay to not be okay. It's even okay to cry if you would need to have that sort of release through tears. And, you can go to therapy and be vulnerable if you would need to. And also, it's okay to ask for support. And that is one of the things that we want to stress here with a Family Network on Disabilities is that it's okay to not be okay. We want to stress to fathers that it is a time that might be a little difficult for you, especially for those parents who have children with special needs. And our motto is that we're here to help. And that's exactly what we want to do today. So come to us should you need any help. And today we are coming to you. We want you to be prepared. These are some of the highlights that we'll speak on in today's webinar. We want you to be prepared, helping you through the application process, understanding what special eligibility will look like, and finally, we'll give you a couple of resources for your families. Now, remember, if you are watching from a different state, please take the info that we have today and adapt it to the location where you are from. And should you need any other info from us, please use that comment section to get in touch with us, give us the information that you would need and how we might be able to best serve you with the info that we have. And with that being said, let's go ahead and get started. We'll talk about Medicaid today. What you need to know. We're all about Medicaid. You're glad that you joined us here today. The Family Network on Disabilities is a 501c3 nonprofit organization helping families in the state of Florida. I did say before, we are a PTI, that stands for Parent Training and Information Center. So we were founded in 1985 by a group of parents who had children with disabilities, and they came together for mutual support and an opportunity to share that information. And one of the things that makes F&D unique is that the majority of the board members, management staff, and program staff, myself included, we're all either parents, family members, or either persons with disabilities themselves. So we bring our shared experiences and our lived experiences to you. And that's one of the things that, makes us who we are. Now, before we get into the body of the webinar, we want you to understand that we do not act as formal attorneys or doctors or even mental health professionals. So the information that we discuss today can't be considered legal or medical advice. We don't interpret the law. We don't provide that type of advice for your families. However, what we do is to provide information and resources and supports that you may need so you can make informed choices for your family. We use research-based information in order to create all of our trainings, and we work in collaboration with state and federally funded organizations in order to create these resources and provide these workshops. And they're all free of cost. So we just want to say thank you and welcome once more from all three of our regional PTIs, popping in the Panhandle, PSN, in Central Western Florida, and Penn in Central to South Florida, and Family Star, which stands for support, training, assistance, and resources for those families who have children with complex medical needs. Thank you and welcome from Family Network on Disabilities. So in this presentation, we are going to learn more about Medicaid and what that looks like in Florida. We're going to talk about the application process, learning different types of terminology, acronyms, definitions that are used in Medicaid, also identifying what documents may be needed when you are applying. We are going to talk about where to apply and how to apply for Medicaid in Florida. You also learn about eligibility for special cases in different populations and other medical service providers that are here, and understanding the different benefits for children. And actually that there is a children's Medicaid benefit for those who are age 0, which is birth to age 21. We'll learn how to take steps for an appeal if you are denied by Medicaid, and also give you a couple of resources in Florida, and with providing you with a list of agencies that can help you along the way. So let's talk about what is Medicaid. What is Medicaid? Well, Medicaid is a federal and state program that provides medical assistance to individuals, and it's based on eligibility. Now, individuals must meet a technical eligibility criteria and also an income test for a coverage group. That funding comes from both federal government, and it also comes from state funds as well. So Medicaid and its services are right here in Florida. It's administered by the Agency for Healthcare Administration. So if you see that acronym, AHCA or AHCA, that's what that stands for, Agency for Healthcare Administration. Now, Medicaid eligibility in Florida, it's going to be determined either by DCF, that's another acronym, it's Department of Children and Families, or SSA, and that stands for Social Security Administration. It just depends on the case. So that's where that eligibility determination is going to come from. Now you'll find these agencies listed with website links on the myfloridafamilies.com website, and we'll put all of those links in for you as well. So there are groups of individuals who may be eligible based on special circumstances as well. So that basis could include populations such as pregnant women, parents, or other caretaker relatives as well, children under age 19, also children from age 19 to 21, and also children who were former foster care children, age 18 up to 26. And we'll talk about that a little bit further into the discussion. So let's talk about those Medicaid regulations. Medicaid coverage is authorized for 12 months. And to continue receiving that coverage, applicants are required to renew each year. So applicants and recipients are required to report changes that may affect their eligibility for benefits within 10 days. And examples of those changes might include pregnancy, the birth of a child, receipt of a new job or increase in earnings, termination of employment as well. It could also include changes such as the arrival or departure of members in the household, changes in certain living arrangements, changes in address, and also if you are relocating to another state. So when you're starting out the process, you are going to need to register for an My Access account. So that stands for Automated Community Connection to Economic Self-Sufficiency. That's the ACCESS, access. So you'll need to create that My Access account before you apply for many of these programs. And you can register for that account at the following link you see right here on the screen. So it's www.myflorida.com/accessflorida/. So if you have any types of changes or you have renewals as well, not only when you're starting the process, but any of those types of changes or renewals can all be submitted through this account. So remember, at the beginning of in the description of the webinar, there is a link there. So if you would like to receive these links that we speak of within the webinar, please RSVP and we can send that information directly to you. So let's talk about applying. How do I apply? So the quickest way to apply for Medicaid is from a computer or anywhere where you might have internet access, but you'll need to create that My Access account first. That's the first step. You also need to go to the Department of Children and Families customer services centers. You can apply there in person if you would rather have a person to help you. So these are all different ways. Online with a computer or other handheld device, or you can go to one of the service centers in person. Now, how you can locate one of those community partner networks as well. And this is a way that also you can apply in person. So you can complete a paper application by downloading it and printing the application. Now, paper application must, after you complete it, it has to be sent in. So that's one step that you don't have to do if you're working online. However, if you prefer to use paper, you can do a paper application by downloading and printing it, filling it out, completing it, and then mailing it to this mailing address that you see right here on the left. And that's the Access Central Mail Center in Ocala. So finally, this process, if you are doing it in paper, it's going to have to be either faxed or hand delivered to that customer service center if you're not mailed. So those are the three ways you can deal with a paper application. Take it in person to a customer service center, fax it to this address, and you see the fax number right here on the left, that 866-886-4342. You can fax it there, or also be able to mail it. So that's how you would deal with a paper application. And finally, you can call a customer call center by telephone to apply. And that number is 850, you see right at the top, 850-300-4323. Remember, if you would need to have any of these links, please RSVP and we can send them directly to you. So what happens after I apply? Well, there's a couple of steps. Step one, the application is reviewed to see if there's going to be an interview that's needed. So if you need an interview, you'll be called within 5 days at the phone number you provided right on the application. Now, if you can't be reached, they'll leave a message and send a notice with contact information. So during your interview, you'll be asked a few questions about what your household situation looks like. And you may also be asked questions to help verify your identity. That leads to step two. So with step two, you're going to provide any additional information if it's needed. That examples of those additional pieces of information might include proof of identity, proof of citizenship or your non-citizenship status, proof of either earned or unearned income for each household member. They may ask for last 4 weeks of check stubs or information on child support or notices from Social Security or the VA, which is the Veterans Administration. So the notice is going to give you a deadline to provide that required information. And again, you can mail it, fax it, or either upload your documents to your My Access account or turn it in that information also to the local office or community partners. We showed you how to do in the slide previous. So you should allow at least 3 days for your My Access account to show that the information has been received. Now, once the application is processed, everyone needs to understand that it may take up to 30 days to process that application, and longer if you need a disability determination as well. So if you sign up for an email notification with the My Access account, you'll receive an email alert about the status of the application. If you're not able to go online, those notices can be sent to you by mail as well. And then after that process has been completed, that leads us to step 4, where your eligibility is determined. So if you qualify for Medicaid, you're going to receive a Medicaid card in the mail for an eligible household, for all eligible household members. And that takes approximately 2 to 3 weeks to get a Medicaid card after your case is approved. And if you need proof of Medicaid eligibility right away, you can print a temporary card from your My Access account. So remember, those are the steps that happens. What happens after you apply? It's going to review your application, then provide any additional information if it's needed. Then they're going to process it, and then determine your eligibility. And remember, it's going to take a few weeks to get that Medicaid card. So if you need an interview, if you need an interview, you'll be called within 5 days at whatever phone number you provide on your application. So during that interview, you're going to be asked a couple of questions about what the household situation looks like, and you can also be asked questions to help verify your identity. So if you need to provide that additional information, you're going to receive a notice that's going to tell you that this is what is getting ready to happen. And the notice is going to give you a deadline as to how long it will take, what date all of these required extra added pieces of information will be needed. And you can also mail those, fax them, upload them to the My Access account, or turn in information to a local office or a community partner. Remember, we went through that portion before. It takes about 3 days for the My Access account to show the information has been received. Remember, we talked about step 2 a little bit previous. It's the same information. We just want to make sure that we reiterate it so you understand what the process looks like within that application continuum. So to ensure every family receives the correct benefit, it can take up to 30 days to finish that application. Now note, if you need to get a disability determination from the Social Security Administration, it may take even longer. So for those of you who have children with a disability or other complex medical needs, this process could take substantially longer if you need to go through both agencies to determine what the disability is and help determine that eligibility factor that way. So after the eligibility is determined and you qualify for Medicaid, remember, you want to get the card. It's going to take a couple of weeks to get that card after the case is approved. And if you need proof of your eligibility for Medicaid right away, you can also print a temporary card from your My Access account. So let's talk about those special groups that are eligible for Medicaid. There are some special groups eligible right here in Florida, and they included family-related coverage. That's groups of family members that are going to be included in coverage. Also, you see here, medically needy. Now, the medically needy program can help pay for Medicaid covered services for individuals who've enrolled in that program, the medically needy program. and they have income or assets that exceed the limits for regular Medicaid. So that means your income is greater than what typically would be seen with Medicaid. So you could have medically needed a program to help pay for certain Medicaid covered services who are enrolled in that type of program. Now, there's also non-citizens and emergency Medicaid. So these people who meet all of the Medicaid eligibility requirements except for their citizenship status. And they might be eligible for Medicaid to cover medical emergencies. And that could include the birth of a child. So that's for non-citizens and emergency Medicaid. Now, the next one is presumptive Medicaid. And presumptive Medicaid health providers and Head Start programs can play a major role in finding and enrolling uninsured children through presumptive eligibility. Now, states can authorize qualified entities, and these are going to be either healthcare providers, community-based organizations, schools, and other organizations as well, to screen for Medicaid and what's called CHIP. That's another acronym, CHIP. That's going to be the Children's Health Insurance Program, and see if those children are eligible for them and immediately enroll them in these programs. So that's presumptive Medicaid. And also, Medicaid can be accessed through SSI, and that's an individual receiving cash benefits from the Social Security Administration, Supplementary Security Income Program. That's what the SSI stands for, Supplemental Security Income. And they're automatically eligible for Medicaid based on the income out and assets of that household. So let's talk about a little bit what each one of those groups would entail. So for family-related coverage groups, there'll be pregnant women, parents of other caretakers and relatives. Let's go back. And children under 19 or children 18 to 21. If the caretaker or relative loses his or her eligibility for coverage in family-related Medicaid, and the family income for the 18 to 21-year-old is considered for eligibility. Also, for those former foster children who are up to age 26, and there is no income test for those former foster children to become eligible. The individual must have aged out of foster care, however, in the state of Florida. So there's also continuous Medicaid eligibility, and that's for children under 5 who become ineligible for Medicaid at any reason, who remain on Medicaid for up to 12 months from the last application. So children 5 to 19 are going to receive a minimum of 6 months of continuous coverage. Let's talk about the continuous coverage. I mean, I want to reiterate that one again. So there are children under age 5 who become ineligible for Medicaid for any reason. They can stay on Medicaid for up to 12 months after that last application. And for children who are 5 to 19 to receive a minimum of 6 months of continuous coverage. So remember, if you lose coverage, they become ineligible up to if their age is under 5 and they lose their eligibility for Medicaid for any reason, they can remain on Medicaid for up to 12 months after that last application. And if they're children from age 5 to 19, can receive a minimum of 6 months of continuous coverage. Just wanted to reiterate that for the family-related coverage groups. And also for those special groups eligible for Medicaid. So there's presumptive eligibility, or PE. That's another acronym that you'll see for special groups, which are seen as eligible based on need. That's qualified hospital providers may elect to make those presumptive determinations based on federal and state policy for special populations. So as we did speak a little bit before, excuse me, as we did speak on it a little bit before, pregnant women are a part of that. parents and other caretakers or relatives, children under 19, or if a mom has Medicaid or is on Medicaid before the child's birth, then the child becomes presumptively eligible up until the child's first birthday. So these are all some of those family-related groups and ways that special groups could be eligible for Medicaid. And we'll add some of those in. If you qualify, remember step 4, we talked about a little bit earlier. If you qualify for Medicaid, excuse me, you'll receive that Medicaid card in the mail for all eligible household members, and it takes approximately 2 to 3 weeks to get a Medicaid card after your case is approved. And remember, if you need immediate proof about your Medicaid eligibility, you can print that temporary card from your My Access account. So to ensure every family receives the correct benefit, it can take up to 30 days to finish that application. So remember, we are continuing to get all of those, all of that information in with those steps. And so remember, if you need to have any other information about the steps, about those special groups, about family-related coverage, about presumptive eligibility, about being medically needy, all of those different aspects, please reach out to us. We are here to help. We can help you with that process and show you how to navigate this process with a little bit of ease. By having someone who can help you through the process, it helps give you a better perspective and makes it just a little bit smoother. So let's talk in just a little bit more in depth about the medically needy group. So individuals who have income or assets that are over that Medicaid income limits, they have something that is called a share of cost. Now, share of cost is a certain amount of medical bills that has to be incurred each month before Medicaid is approved. So this is what your share of cost is, which is sort of like an insurance deductible. So the share of cost may be estimated based on the statement of your family's monthly income. So it's going to include paid and or unpaid medical bills must be provided to determine if the share of cost has been met. So there's emergency medical assistance for non-citizens. And if you meet Medicaid, all of the Medicaid eligibility requirements, except for your citizenship status, you may be eligible for Medicaid to cover medical emergencies, including the birth of a child. So if you are a non-citizen, you must file a complete application, provide those verifications, social security number or cooperation with child support enforcement is not required. Non-citizens in the US for a temporary reason, such as traveling for business or either traveling for pleasure as well, they are not eligible for emergency medical assistance or any other Medicaid benefits. So I'll say that again, non-citizens in the US who are traveling either for business or traveling for pleasure are not eligible for emergency medical assistance or any other Medicaid benefits. So let's talk about those who have eligibility under SSI or SSDI. So an individual who is receiving cash benefits from the Social Security Administration, and that's SSA, Supplemental Security Income Program, that's that acronym SSI, they're automatically eligible for Medicaid based on income and assets. So when the cash benefits terminates, Medicaid coverage will continue for 2 months beyond the SSI payment end date to allow time for DCF to review eligibility under other coverage groups. So continuous coverage applies to children if they lose their SSI benefits. So if you need more information or to report any changes, you would call the SSA, and we have a telephone number for you. Remember that number, I'll speak it right quick. It's 800-772-1213 or you can visit the SSA website at www.ssa.gov. Remember, use the link to RSVP that's in the description, and we can send these links directly to you. So if SSI benefits terminate, that Medicaid is going to continue for 2 months beyond the SSI payment end date. Children will receive continuous coverage, and this is the information that you would need to call them to report any of those changes. So there are other medical service programs as well. We talked about CHIP a little bit earlier. It provides medical coverage for children under 19, and their family income is above Medicaid income limits. So the household is responsible to pay that monthly premium. That's the Children's Health Insurance Plan. So there's also other medical service programs, including the Federally Facilitated Marketplace, that's FFM. And that's for children who do not qualify for Medicaid or CHIP. They're referred to the FFM. That's the Federally Facilitated Marketplace. It's an online marketplace for health insurance, and it's going to provide a premium assist for adults and children. You can find all of that information at healthcare.gov. So individuals may qualify for advanced premium tax credits to help pay for the health insurance premiums. We'll put the information for that also in an online document, so that if you would like to receive any information as to how the FFM works, remember, use the RSVP link. We can send these links directly to you. So there are also other medical service programs, including CMS. CMS is going to provide case management services for eligible children. It's going to provide family-centered programs to ensure children get the care that they need. So in order to be eligible, you have to be a child up to the age of 18, and children who have special behavioral or physical health needs, and have also a chronic medical condition. Now, CMS provides access to specialty programs also, such as child protection and safety, child and family information, early intervention and child development, and also newborn screening. So let's talk about community partner networks. This is going to be a network that provides access to services, and it provides local access points for families. So by maximizing shared resources, that network increases customer access to those services needed to strengthen families in the local community by providing 2 different levels of involvement. It's going to be a self-service site where they provide the equipment to customers so they can apply for assistance, check on status of an application or redetermination of benefits, report a change, or even open an account online. Sometimes those may be computer centers. And they also provide general assistance in explaining the application process. And there's also an assisted service site. So they're going to provide the equipment also necessary to customers to apply for benefits, to check the status of that app or report a change. And also they provide assistance to the customer to submit a web application. It verifies the identity of the applicant and also provides case status information or any outstanding information needed to determine their eligibility. So we can give you also a listing of community partners, and that can be found at that My Florida Families website at www.myflfamilies.com. So lastly, we'll talk about steps to take if you are denied. So the Office of the Inspector General conducts administrative hearings on behalf of DCF, which is the Department of Children and Families. Everyone has a right to a fair hearing. So if you like to request a hearing, you go to the Department of Children and Families office, or you can call the customer care center at this number you see right here on the screen as well, or email the appeal hearings section by the email address you see here. It's important to follow all of those deadlines that were required because there's a time limit to appeal. And that depends on what those rules are. But remember, it's very, very important that you follow the deadlines that are required. So we have a few Medicaid resources that we could provide for you. This is a good screenshot to take. And also, if you use that RSVP link that is right in the description, we can send you this information directly to you. So there's the Medicaid website we talked about it before, myfloridafamilies.com. Also, topical fact sheets are on that website as they would relate to family-related Medicaid, an SSI fact sheet, and also a Medicaid program fact sheet. And in order to access those, you can also start your application and find other information, make changes, make requests, all of that through the My Access account, through your My Access Florida account at www.myflorida.com/access. So here are a few family resources. With the Family Network on Disabilities, this is how you would be able to contact us at www.fndusa.org. There's also the Center for Parent Information and Resources with the Parent Center Hub link, parentcenterhub.org. Also, Family Voices. They're a national grassroots network organization of families and friends of children and youth with special healthcare needs and disabilities. They can be found at familyvoices.org. Also, with the Federation of Families, they provide education, they provide support and advocacy to children with emotional, behavior, and mental health challenges. And they can be reached at www.ffcmh.org. And also, there's Disability Rights of Florida, and they protect the civil rights of people with disabilities here in the state of Florida. And they can be reached also at disabilityrightsflorida.org. So if you would like to receive any of those resources, please let us know. Use the RSVP link, send in your information. We can get that information directly to you. So we want to stress again that this is our family, the Family Network on Disabilities. And here you see a representation of all of our regional PTIs, our regional programs, as well as Family Star, which encompasses the full state of Florida. Also, Dadvocates, which is a father-to-father support group for those fathers who have children with disabilities, and also F&D Trust Services. So if you would like to have downloadable resources given to you, this is a good screenshot to take as well. You can visit our website at www.fndusa.org. Also, doing the /ESE download is a way that you can have all of those one-pagers digitally optimized for your handheld or laptop or any type of computer device for you. They don't take up a lot of space on your hard drive. They're easy to access, and you have compact information right there if you are not able to watch a full webinar. So our resources are in English and Spanish, and you can follow us on various social media channels such as Facebook, Instagram, and Twitter. Remember to contact us if you need to have more information. We are the Family Network on Disabilities. You can reach us at 1-800-825-5736. Again, that number is 1-800-825-5736. And with that, let's go ahead and go back to the overview here. We talked about the application process. We talked about special eligibilities for Medicaid, and also a few resources for Florida families. My name is Latasha Berg. I'm the Multicultural Outreach Coordinator for Family Network on Disabilities, where we are striving for complete integration and equality of people with disabilities in a society without barriers. Now, would you like to schedule a live workshop for your organization, or just to have more information please send your request here. Use this link. It takes you directly to our inbox. Put in all the pertinent information, and that is how we'll be able to direct you to the regional PTI or statewide program which may best assist your needs. I can be reached at lbird@fndfl.org and by phone 1-800-825-5736. Remember again to visit our website at www.fndusa.org. Remember to join us here on either one of our social media channels for other free workshops that could assist you in your journey of parenthood with your child with special needs and other disabilities. Remember, at FND, we are here to help. Thank you so much for joining us and have a wonderful rest of your day.